All right, so 10-year-old girl has difficulty walking, progressive weakness, and diarrhea and weight loss. And she's got diminished proprioception, decreased vibratory sensations in the lower extremities, and hyperreflexia. Also mild hemolytic anemia. What's responsible for her symptoms? Okay, so one thing we should notice about these questions, just from a step one strategy perspective, is these guys, A, E, K, you're only missing one letter, D. These are all fat-soluble vitamins, and niacin, riboflavin, and thiamine. So in this question, we'll also pretend that she's got acute pancreatitis, and that's going to help us with our answer here. Even if it didn't, this is still just a good question, so we can note important findings like proprioception, decreased vibratory sensation. So let's talk about niacin, this first one. Niacin, riboflavin, and thiamine, these are all water soluble, so unaffected by fat malabsorption. So if this is acute pancreatitis, then it's not going to be any of these answers. And niacin deficiency causes the pellagra, that's the dermatitis, diarrhea, dementia, the 3Ds. So dermatitis and also the diarrhea, which we see, and then dementia. Riboflavin, this causes normocytic anemia and mucosal changes. So not going to be that one. And thiamine deficiency, that's the dry berry, that's the beriberi and the Wernicke-Korsakoff stuff. And vitamin A. Okay, so vitamin A is night blindness, dry eyes, dry skin. That's pretty much it. Vitamin E is going to be our correct answer. That's a fat-soluble vitamin. And so in acute pancreatitis or something like that, you'd see problems with fat malabsorption. And this is associated with susceptibility of neuronal and erythrocyte membranes to oxidative stress. So if you don't have vitamin E, then your neurons and your erythrocyte membranes are going to be attacked by oxidative stress, ROS stuff. You're going to be attacked. And so that's why you have these problems with proprioception, ataxia, peripheral neuropathy like hyperreflexia and hemolytic anemia, because this guy is an antioxidant here. So that's going to be a correct answer. K is hepatic synthesis of the clotting factors 2, 7, 9, 10. And so you have easy bleeding and bruising. So we'll look at our explanations here if you want to kind of pause and look at some of these. So yeah, it's the neuronal damage is affected because the long axons are protected by E. Red blood cells are also more susceptible, so hemolysis and anemia protected by E. Neuromuscular symptoms, ataxia, the long axis, niacin, pellagra, the 3 triple Ds, glossitis, normocytic anemia. All right, so hopefully that's helpful. If it was, like and subscribe. If it wasn't, let me know why. And if I can improve these videos, I will.